There are a variety of reasons to deal with health care, and the programs that are being outlined here and proposed in the state of Utah are very much in concert with the program that I've been working at the federal level. And as I've tried to immerse myself in this issue, I've discovered several things that I hadn't known before that you might find of some interest. The first thing I've discovered is that the major and most effective program of cost control in health care is quality. The best health care is the cheapest. Speaker Clark referred to that when he talked about keeping people healthy. That's the most important thing. We do not have any economic incentive for you to stay healthy in our present situation. And our present health care is driven by the federal tax laws. Nobody sat down and designed the health care system we had. If they had, we'd have had a much better system. It just kind of grew, and it grew out of the federal tax laws, particularly those tied to the tax situation in World War II. Well, for a time that was fine until we began to realize that it meant that the individual who determined what kind of benefit you would get with respect to health care, spending your dollars, was not you. These were dollars that were given to you as compensation, but you had no control over how they were spent. So if your employer decided he wanted to put you in a health maintenance organization that you didn't want to be in, you didn't have any control over those dollars. We got ourselves into the situation where the person making the decision as to how the dollars would be spent was not the same person as the person getting the service. That's the mess we've gotten ourselves in with health care. There is no economic incentive for you to stay healthy. We pay only when you get sick. And we start clamping down on cost control in such ways that the whole system gets distorted. And no one really knows who the best people are because the insurance companies are negotiating for the best price. And as I say, the thing I've discovered is that the best cost containment circumstance comes from those people who dedicate themselves to quality and don't worry about anything else. Dartmouth University has done a study, and they said the best health care is available in the United States in 3 cities: Seattle, Washington, Rochester, Minnesota. Why Rochester, Minnesota? The Mayo Clinic. And Salt Lake City, Utah. The University of Utah, in connection with Intermountain Healthcare, driving down costs in an effort to create quality. And they said if every American got his health care in Salt Lake City, Utah, it would be 1/3 less than the national average. Now, 1/3 less. Let's go back to those figures I talked about at the beginning. The mandatory spending. What would it do to our national budget if we were to cut Medicare and Medicaid spending by 1/3? That'd leave a lot more revenue left over to deal with the discretionary spending. It would make a significant impact on the federal budget. So that's why I have immersed myself in an effort to try to deal with health care, and I've discovered that we cannot solve our health care problem until we change the federal tax laws. And that gets back to the Speaker's point that he can't solve the problem in Utah unless we change the federal laws. So we are now in the midst of a major effort to try to change health care. And that means you as an employer would be relieved of the problem of trying to pick the best health care plan, because all you'd have to do is say, there's so much money here, employee, I give you the money I've now been spending in, quote, benefits, and you go out and make your own decision. And the free market, competition, all the rest of it, I could go on in great detail. Bottom line, all of this was reduced to a bill introduced by Senator Wyden of Oregon and Senator Bennett of Utah. It's called the Wyden-Bennett bill in Oregon. It's called the Bennett-Wyden bill in Utah. And the Congressional Budget Office went through the whole thing and they gave it a budget score. I've discovered since I've been in the Senate, doesn't matter anything else, the one thing that matters is the score. We have a score on Bennett-Wyden that says over the same period that President Obama would be increasing spending by $685 billion, our program would save $1.3 trillion. Now, I'm a businessman. That's a $2 trillion swing. And in the circumstances that we're talking about here, to take $2 trillion in cost out of the nation's healthcare system would make a significant contribution to our budget problems, at the same time making things better. Now, I can go into all the details. Your eyes would glaze over. I put some of you to sleep already. Let me just say that the debate is going forward now, and the one thing I like about it is that Wyden-Bennett, Bennett-Wyden is in the center of this debate. There are a number of other ideas, but I said at the White House when the President convened a summit on health care, I said, you know, I have something no one else in this room has. All kinds of ideas and proposals. I said, I have a score. And then Senator Dodd spoke up and he said, when Senator Bennett said, I have something nobody else has, I thought he was going to say, I have co-sponsors. Because when we started this, we called it the Noah's Ark bill. And that is, every time you got a Republican, you had to have a Democrat. You get on this bill 2 by 2 so that we keep it bipartisan and keep it out of some of the contentions that have been around the health care issue. It is an enormously important issue. We need to make sure we do it right. I don't want to be partisan, but let me close with this one last comment. I've had a lot of people say to me, well, Senator, we really like this, but we have one additional request that we would like to put in. It's very much along the lines of what Speaker Clark was talking about, where individuals could make their choices. And many of the insurance companies have said, you know, we could really change the marketplace if we had that many individuals chasing individual policies. Right now, the individual policies are very expensive because the market is so small. You're driven to the employer-based system. If you have something this flexible, we could compete with that and we could bring the prices down and everything would be great. Okay, say those folks who approach me, we just want one additional option in addition to the private plans that would spring up and be available. We want Americans to have a public option. I said, what do you mean by a public option? Well, let's have a government plan financed by the federal government as one of the options as to where they could take their money. And I said, if we put a public option as one of the choices, I'm voting against my own bill. Because that is the slippery slope that leads to Medicare for all. You have a program that the government would subsidize, guarantee that the prices would be fixed, the market would not be able to compete against that, and then at the back end, with the government subsidy, comes the kind of mandatory spending obligation that I talked about at the beginning. That's where the fight is going to take place at the federal level, because I think there's enough traction for the Wyden-Bennett point of view that we will start the debate there. But if they insert the public option in it, then you will see a lot of people, myself included, fighting against it. Bottom line, we have to address it because the numbers are so huge, but we have to address it carefully because the stakes are so high.